Once brought into the world, we are expected to rise to the occasion and make a mark on the world. Some do not have this ability to rise and are left behind and forgotten. We often need reminding to stop and give a helping hand to those who cannot rise on their own. Today, I will inform my audience on periventricular leukomalacia, or PVL for short. For many years, I was told nothing was wrong with my son. He was 4 years old, nonverbal, and had developmental delays. At 4 years old, he was diagnosed with periventricular leukomalacia, and a year later, he was diagnosed with autism. Although PVL is rare, today I will talk about the location in the body, some of its side effects, and who's at risk. It is important to understand the location of PVL. According to the article, What is PVL in Children on Cedars-Sinai.org, PVL is located in the white matter of the brain. The white matter is the inner part of the brain and is the location site where the cerebral spinal fluid is. Within the white matter, information is sent to nerve cells and spinal cord. Within the white matter, when the brain is damaged or dies, it forms holes or fluid-filled sacs, and these sacs are known as periventricular leukomalacia. Leuko means white, malacia means softening. To detect PVL, you would need an ultrasound or a CT. You can detect PVL as early as 4 weeks after birth. Now that we've spoken a little bit about the location PVL is found, we're going to speak a little about some of the side effects. As PVL Symptoms and Causes on childrenshospital.org puts it, every child with PVL is unique. Some of the symptoms involve your vision, heart, muscles, mental and verbally. Cerebral palsy, muscular dystrophy, autism, vision impairment are all associated with PVL. PVL is not curable. It will not get better. It will not get worse. Now that we spoke about location PVL can be found and some of its side effects, we're going to speak about who's at risk. After reading the article PVL from cerebralpalsy.org, I can share with you that any baby can develop PVL. However, babies born before 32 weeks have a higher risk. Some of the other factors can include infection, being a twin, vaginal bleeding during pregnancy, drug and alcohol use, and if the baby went without oxygen for a number of seconds in utero or after birth. I would like to remind you that today we spoke about periventricular leukomalacia, or PVL for short. We spoke about the location in the body, some of its side effects, and who's at risk. We are all made unique, and no matter how uniquely made we are, we should all be loved. So remember, if you see the opportunity to lend a helping hand to someone in need, you should.